This week we did pass out of the Health and Education Committee a comprehensive health reform bill, which now will be available for the full Senate to consider. There's also a separate bill that's being developed in the Finance Committee. I'm fortunate to serve on both of those committees, and I'm involved in the development of both bills. So when the two are reported from the committees, the Majority Leader will combine them into a merged bill that the full Senate can consider. Well, the bill that we reported out of the Health and Education Committee makes the point at the beginning that anyone who currently has insurance, health coverage that they want to maintain, they're able to do that. They're able to add family members to that policy. If there's an employer that has a health policy covering workers, that policy can continue and can be renewed. So we start with that basic premise that what currently is working will continue to work. And then we say, okay, as to those who have no coverage or who have inadequate coverage or coverage they're not happy with, how do we fix that? And there's a variety of things we do to try to fix that problem. Yeah, one of the provisions in the bill that has become somewhat controversial, but I don't really know why it needs to be, is the idea that the Secretary of Health and Human Services would establish a nonprofit entity that would then be a choice that people could make as a place to purchase their health insurance. It would operate on the same basis as private health insurance plans. It would have to pay the same fees, would have to charge enough in premiums to cover the cost of the services it's providing and administrative costs as well. And it would be a competitor in the marketplace with private sector providers. And I think it would be a good thing for our state to have that available. I think it would be a good thing throughout the country. Well, there are a variety of provisions being considered, particularly in the Finance Committee, as to how the cost of the legislation would be covered. As far as individuals are concerned, everyone would be required, every adult in the country who's legally here would be required to obtain coverage. If they did not obtain coverage, they would then have a penalty of $750 per year assessed against them for failure to obtain coverage. That would be an incentive to try to ensure that everybody does get coverage. Employers of 26 or more employees would either provide coverage or when they add their 26th worker, they would have to also pay $750 per year for that worker and for additional workers beyond that. Yeah, one of the main thrusts of this bill is to do what we call reforming the insurance market, the health insurance market. There are a lot of policies that are currently written as health insurance policies that have a lot of loopholes in them and a lot of gimmicks to ensure that the company doesn't really have to pay when you get sick or need the coverage. We would put an end to that by requiring that any company that is offering new health policies in the future would have to cover certain basic benefits, could not decline or refuse to provide the coverage because of pre-existing conditions. Could not just cherry pick who's able to buy the policy, would have to renew policies if people wanted to have those policies renewed. These are insurance market reforms that I think virtually everyone, Democrat and Republican, agree ought to occur. Well, another major thrust of the legislation is to put more emphasis on keeping people healthy rather than just dealing with them once they get a chronic illness of some kind. So there is much more attention to prevention. We would require that health policies in the future provide preventive services for a very low copay, and that be included in all health policies in the future. We also put a great emphasis on training of additional primary care physicians and healthcare providers. Our system of medicine today it differs from the system in most countries in that we put greater emphasis on developing specialists and less emphasis on developing primary care physicians, which is the real need we've got if we're going to expand healthcare coverage throughout the country. Thank you again for watching. I hope you find these podcasts of interest.